Hey, you're on, Priscilla.
I'm
So,
on.
how was your experience?
It was literally the most wonderful dental experience I've ever had.
Good. So tell me, like before you came here, what was your, how did you feel about dentistry?
I had a fear of dentists ever since I was little. Every dental experience I've had has just been not the best. I mean, I've had really bad experiences where it's led to panic attacks, and it wasn't just the care, it was just the demeanor of the office and everything. And it was just, I always dreaded going to the dentist, always postponed even my cleanings just because those were uncomfortable and they hurt, and I just felt like every dentist I've tried, which are a lot, just didn't, they just didn't care. They just go in and clean your teeth, and it was just, I was always in so much pain, and it was just always so bad. And that's why it even took me a while to come to you. I've heard so many people with great experiences with you, and I said, okay, I'm gonna go to Dr. Bernstein and give him a shot. And honestly, it was just awesome. From the moment I came into your office to when I left, I never thought I could have that great of a dental experience ever. I mean, you guys were so warm and gentle. You felt like you made me feel cared for, and you were attentive. The pain was nothing. I mean, minimal to nothing. I mean, it was just awesome. You guys provided me with more than I ever thought I could get from any dental office.
So do you remember what we did?
Yes.
Or do you have some knowledge of what we did? Maybe you don't remember what we did, but do you know what we did?
I know that, well, I came in, and it took a while for me to get kind of groggy and comfortable, but I know that you filled, I think, 10. You did 10 fillings, right? And then you also did a full cleaning. All in all, it was about a 4-hour experience, because I came in at 8 a.m.
Right.
And by the time, because you even walked me to my car, which who does that? It was like 1:30. I didn't get home until 2 o'clock, 2:15. So I was here for a while.
Okay.
So yeah, right, 10 fillings,
Yeah, that sounds about right.
Cleaning, and it was a lot in one day, which I didn't even know a dentist would be willing to do all of that in one day.
Yeah, one of the nice things about sedation is that you can get a lot of work done all at once and have it just be all done.
And I was so comfortable the whole time. I didn't feel anything. I could hear you talking, and I was aware, but I was so beyond comfortable. I mean, it was amazing.
Good.
Amazing.
And afterwards, how did you feel?
It was fine. I actually, like you said, I actually rested and slept until about 7 p.m. that night. And I kind of made myself get up because I didn't realize it was already 7.
So it was your daughter's birthday? It
was my daughter's 10th birthday. But, she was very understanding. We had a slumber party for her Saturday. So, she knew Mommy's been having teeth problems, some pain in this tooth especially. And she knew that, Mommy has been scared to get this done and is finally getting done. So she, even if it was on her birthday, she was understanding. And
oh, that's good.
Yeah.
So how did you deal with this in the past when you went to other dentists? How did you deal with going to the dentist?
I hated going to the dentist. I mean, even for cleaning, I thought cleanings were so painful. One cleaning I had in particular, it was so bad that when I left, and it was painful, but I was trying to hold in what I was feeling. And so when I was driving home, I had to actually pull over because I started having a panic attack. And I couldn't breathe because I was in so much pain when he was cleaning me, because they weren't very gentle. It was rough, but I didn't want to tell them at the time because I didn't want to seem like I was whining or being a difficult patient. So I kind of just held it in. But I had to pull over because I couldn't breathe. I started having a panic attack of all the pain I felt and keeping all that stuff in the whole time I was there.
Would it surprise you to know that there are a lot of people that have this exact same feeling? They're terrified of the dentist?
No, I mean, I've heard of some people being terrified, but I didn't know that because people I've talked to, they're like, oh, I love my dentist and I love doing my cleanings and all this stuff, and I just didn't think that anybody would be as scared as me. But I guess now I'm finding out there's more people that feel the way that I do.
Well, there are a lot of people who have no problem going to the dentist. They come to the dentist, everything's fine. They've never had a bad experience. They're easy to numb. Nothing bothers them at the dentist.
Right.
But there are a whole lot of other people who have a different experience. They're difficult to numb. They gag. They get claustrophobic.
Really?
They're afraid of the injections. They're afraid of the pain. They don't like the smells and the sounds. And what would you say to those kinds of people?
Well, I would say they need to come to you.
Okay.
I would say they need to come to you.
That's awfully nice of you to say.
No, because they wouldn't experience any of that here. I mean, you guys are so caring. You booked out the morning for me. I mean, your full attention, Brittany's full attention, Allison's was all about me. And I don't think that they would ever experience that here. And I think my fear of dentists now are gone.
Oh, that's so good to hear.
There's nobody else I would see in the future but you. I mean, there's
thanks,
no
Priscilla.
way.
That's very nice.
From here on out, I'm going to be now one of those people that say, oh, I love my dentist. I love going to my dentist. So for those people, I would say, come here.
Great.
And I've been telling a ton of our patients about you. I told Dr. Cedars and everybody how amazing you are, and been spreading your name to all of our patients and my friends already and everything. I mean, I said to them, it was literally dental heaven. Seriously, it's like dental heaven.
Thanks, Priscilla. That's really nice.
True. So.
All right. Well, we're going to do a post-op for you now, so we'll say goodbye.
Bye.